Welcome back for another episode of Physio Show. Today we're going to be focused on how to identify C1, C2 rotation dysfunction in those with cervicogenic headaches or anybody with mobility deficits and neck pain. So in this video we're going to learn three things. First, how to identify C1, C2 rotation dysfunction in clinical practice. Second, a great manual therapy technique to help correct it in the clinic. And third, what to provide your patient at home to help promote gains between visits and get better outcomes. So let's dive in. All right, the first thing you need to do is screen for C1, C2 rotational dysfunction. So in individuals with headaches or have limitations rotating, this is a good test to perform. All you need is the patient to lay supine. What you're going to do is support the head. And what's really important is we maximally flex the head. Otherwise, you're not going to be able to lock out the lower cervical spine, and we're not going to be able to judge if C1, C2 is dysfunctional. So I like to put the hand right on the forehead. We're going to maximally flex. Chin usually will get up to the sternum, and while maintaining cervical flexion, we're going to rotate the patient's head to one direction. And we're looking for at least a cutoff of 32 degrees or a 10-degree difference side to side. So if you identify a mobility issue with the flexion rotation test, a great way to address that in the clinic is immobilization with movement. So to perform, you're going to have the patient sitting. You're going to wrap your hand around the patient's forehead, and you're going to contact the C1 segment with the fourth and fifth digit. So this is going to be my mobilization hand. My stabilization hand on the same side as me is going to contact the C2 facet. To find the C2 facet, what you're going to have to do is find the base of the skull right in the center aspect. You're going to drop down until you find the first spinous process. That's going to be C2, and a good way to kind of make that more pronounced is to nod the patient's head slightly. And again, the first bump you feel is C2. So what you're going to do is drop laterally off towards you, and you're going to be contacting that C2 spinous process. So that's where you want to stabilize. And now what's really important to note with this technique is to make sure you minimize any protraction of the patient's head with this movement, because you're not going to be able to isolate that segment. So we want to maintain a more neutral position here throughout the immobilization. Another thing to take note of is no side bending the head as well. We want to keep an axis of rotation right over the transverse plane. So contacting C2 with my stabilization hand, C1 is the fourth and fifth digit, maintain neutral. As we're going to ask the patient to rotate their head towards you, and you're going to rotate as far as you can until resistance is met, and then back off. And repeat. About 10 repetitions, trying to go further and further in the range of motion with each repetition. Now this can be a little uncomfortable as this area tends to be tender, so a little bit of soft tissue mobilization prior to this technique may help. One of the most research-based exercises one can do for cervicogenic headaches or anybody with C1, C2 dysfunction with a positive cervical flexion rotation test is a snag. While this exercise is extremely common, I would argue it's probably one of the most improperly done exercises. And there's a couple of key setup strategies and cues to give to your patients for this to be done properly. And the first thing is, don't do it sitting, because you're going to get a ton of thoracic rotation and there's going to be less contribution or movement in coming along at that cervical spine. So let's get them up and right against a wall. This is going to help stabilize the shoulders and thoracic spine and really promote only cervical rotation. And step two is maintaining cervical neutral with this exercise. You'll see a lot of patients perform this exercise in a very protracted state. So when they perform it, when they wrap the band around their neck and rotate, they're just slamming these cervical facet joints together, really not getting a lot of mobility at that C1, C2 segment, and honestly just creating more discomfort. And step three is ensuring that we have proper alignment of the band in a nice angle, 45-degree angle upward. This aligns with the cervical facet joints so that when we rotate, we're going to get maximal movement. Okay, and I really like to use a thin band when I perform this exercise because it really nicely hugs the C2 segment. So to recap, shoulders against the wall, cervical neutral, 45-degree elevation upwards, stabilizing arms going down, and we're going to rotate as far as we can to the end range, 5-second hold, return to neutral, and then back on. Going further each round. Well, I hope you enjoyed this episode of Physio Show. If you did, hit that like button and don't forget to subscribe so you can learn more about your body, how it works, and what it needs to keep moving.